Hello, it's Nick. It is Monday, May 4th, 2020, and I am taking the time right now, after I got home from work, to respond to a few comments that I received in response to my comment to a post um, on social media regarding wearing a mask and kind of everything that goes around it. I think this will pretty much be the last time I talk about masks on my channel or on here in general because I think I've beaten this one to death and gotten my points across, and I think people are pretty clear on where I stand and why I stand that way. But I wanted to make a final point on this. Not sure if I'm going to share this with these people or not. Maybe if they ask for my response to these things, then I'll link them to this. But at this point, I'm going to keep it here just as kind of an archive to what I've been thinking and some of the thoughts I've had, and keep it in video form. So let's get into it. So two things that we're addressing this. One is basically calling out people who don't wear masks, particularly me because I was the one interacting, or asking, do you think that you're selfish for not wearing a mask? And the other one was in regards to your rights to your body. And I thought these were two very good points that were brought up by the other people. And I thought I would and I had like about a day to kind of really think about, well, what are the rights I have here, and am I being selfish for doing this? And then I thought about it more over the last day and came up with a few thoughts that I think address both of those things. All right, so the first thing I wanted to address was about the right to wear a mask or not. And the argument mentioned by one of the people in this comment section was, just because you have the right to do something doesn't mean that you should exercise that right. Now, I'm not going to say I agree. And here's why. Your rights should not be infringed on, period. That's my view. And we can also flip this in the sense that even though you have the right to wear a mask, should you really exercise it or wear it all the time? I've seen people out wearing masks literally 24/7, even when they're alone riding a bike or alone walking or alone running or in their house alone. So just because you have the right to do it doesn't mean you should do it. It works in the context of not wearing a mask the same ways it does wearing a mask. And I wanted to mention one more thing regarding that is, it was a question that came to my head is, well, why was the mask, either buying one or making one for yourself, why was that not the first recommendation by the CDC when we know that now you can make your own mask out of things out of your house? Why was that not the first thing? And I saw a Facebook post. I don't want to reference this Facebook post because it wasn't like an article, like peer-reviewed things, but it was thought-provoking at least, and it was about how wearing certain types of masks actually will reduce your oxygen intake. And it mentioned like a threshold of, I think it was 19% on there, or 19 point something. Anything below that is okay, but if it's reducing your oxygen intake by over a certain amount of percentage, it could be having adverse effects on you. So I'm not saying that that's like a reason to not wear masks, but it begs the question is the solution, I've said this before, and I know some people claim, oh, it's a right-wing talking point, but no, it does beg the question, is the solution worse than the actual problem, or is the solution causing more problems than the actual problem itself? And I think it's important to not just be singular-minded and one variable, not use just one variable analysis is the word I'm thinking of, because I can think of many examples in my personal life and my work that doesn't have to do with the health field, but I know that when I'm analyzing something, I don't just take into account one factor, but I also take into account that one factor's effects on other things. So it's important, I think, to look at all the factors and don't harp on one when it could be affecting other things, or if you don't look at these other things, those could be actually worse than that one thing. So I'll just wrap up with that about rights to wear and whatnot. So one more thing, another thing that was kind of thrown out there was, how don't you feel like you are selfish for not attempting or preventing or reducing, is the word they used, the spread to other people? And maybe they just misworded the word reduce. But one thing I thought to my head popped in my head, sorry, is I didn't know you could half spread the disease to someone, or the virus, I should say. I thought it was either you give this person the virus or you don't. I'm pretty sure that's how it works. So the idea of reducing the spread, I think, is maybe the wrong wording. Slowing the spread would mean, okay, I'm infecting as little people as possible. So to me, the mask, yes, if you want to go out and live your life and do whatever you want, interact with tons of people, and wearing a mask, obviously, it's going to have some effect on that. But if you are not wearing a mask, but you're reducing other things, like your interaction with people, how many times you go out, how often, where you go, when you go, that kind of thing, I don't think you can really harp on someone for not wearing a mask if they're doing all these other things. Whereas if you're wearing a mask and not doing those things, it's still like, which one is better? I know there's studies that say percentage-wise what all these things can do, but at the end of the day, it's individual people's responsibility to take their own action and how they feel they can help slow the spread or help the general population, right? So I don't think it's a one-size-fits-all, and we're seeing that in the responses by governments in each state, or by governors in each state, how they're each tackling it a little bit differently. So the idea that everyone in the United States, no matter where you are, what state you are, what city you are, what neighborhood you're in, that everyone should follow the same exact guidelines, to me is a little bit unfair, and actually might be making other problems worse that some places aren't seeing over others. So I just wanted to make sure I got that in there. And one other thought I wrote down was, I thought the goal was to slow the spread, not eliminate it. I think that's food for thought. And if the mitigation measures were meant to completely eliminate the virus, then all models would be flat when they're implementing these measures into their data or into their forecasts. So I thought that was another thought that I had. And but also that means that since these models did put into account social distancing, mitigation measures, which, by the way, a lot of these are still experimental in the world, as they haven't been done on this level before, then those models are assuming that not everyone is doing everything. And that's the bingo part of this, which is you cannot expect everyone to do everything, because we live in America where we have personal freedoms. And these models show that there is a middle ground, because it is impossible to completely shut down the entire country or economy, whatever, world, without a major population drop-off from other cases or many other causes. So that goes back to my point that I made earlier, which is, yes, you can pinpoint this one issue, but is solving that one issue with a certain remedy creating a whole bunch of more issues? And I think this goes back to the idea that not all things good come with just good. Like, there's some bad to it. There's some trade-offs you have to make, and time will tell which trade-offs were worth it and which ones actually made things worse. So we'll see. Another thing I wanted to point out was calling someone selfish for doing something that you don't agree with is actually a selfish thing to do, if you really think about it. Criticizing someone for not doing something you do, or calling them names because they are choosing to live their life differently than you, is selfish in a way, because you're saying, well, because you don't live the life like I do, you're bad and you need to conform to me or else you're bad, kind of thing, and which I don't think is right either. And it would be selfish if I was saying that I'm not taking any precaution at all. I don't care. I'm not washing my hands any more than normal. I'm not keeping my distance from people any more than normal. I'm going to touch my face whenever I want to. I'm not going to wear a mask. I'm going to live my life exactly the way it was before. That would be selfish. I'm doing the things I normally do, but I'm just being more conscious of the hygiene part of it, or the frequency in doing those hygiene things that I normally do. So I want to make sure I got that point. Yeah. And a lot of these people that, I'm not these people in general, but people in general who claim to be very tolerant or very accepting, seem to be the ones, and I'm not talking about the people that I'm specifically interacting with in this comment section, but seem to be the ones that are the first to point out that you are X, Y, and Z because you're not wearing a mask because I believe in wearing a mask, or you are selfish for going to protest even though I protested a few months ago for a different issue. That's where the hypocrisy comes in, and that's where I think you start losing credibility. I'm proud to say that a lot of the views that I hold related to masks are actually consistent with other things I believe, and I actively work to make sure I don't have that cognitive dissonance that a lot of people like to throw out recently, meaning that one of your views conflicts with another view of yours, or you're not consistent over your viewpoints that you have. So another thing I wanted to touch on was the whole healthcare worker side of things, because I got another comment from someone in that same comment section that said, I can't understand how it's so effing hard to put a mask on to protect frontline workers, like someone in the thread who is a frontline worker, to protect their health and safety. And I wrote this down on my lunch break because I had thought in my head, and I was like, I need to write this down and read this out. So my thoughts on this were, last time I checked, people working in the healthcare industry, which I know healthcare workers are being lumped in as like nurses and doctors, but really I think that encompasses like the administrative side, the insurance side, everything. So I'm specifically talking about people on the front line interacting with sick patients. Didn't want into a situation, or don't walk into a situation and say, let's just hope for the best. Let's not do anything. Let's just kind of hope we don't get sick, or let's just hope we don't get transferred anything that this patient is going through, even though we don't know anything about them. Fingers crossed, let's hope we don't get it. No, they take precautions to ensure whatever the patient is going through doesn't transfer to them. So the one variable singular train of thought expressed in calling people out for not wearing masks doesn't hold up when you consider more than one variable in a situation, which is kind of what I touched on earlier. So I don't think everyone taking every possible precaution is actually helping healthcare workers or the population as a whole, because I think it's actually hurting by having hospitals reach the brink of financial ruin and possible closures, leaving us with less healthcare workers to care for the sick, and everyone's mitigation measures are all for nothing if healthcare workers aren't able to properly protect themselves on the front lines or even have a job in general. And that is what we're seeing happening, is these hospitals are actually way under capacity to the point where they're actually laying off staff and even more in financial ruin than they were before, which actually supports the idea that maybe, and this is going into conspiracy territory, but it could very well be true, that this was part of the harnessing the virus and really exploiting it to bail out hospitals that are already in financial ruin and bail out the entire healthcare system that was clearly broken. I mean, we can all admit that nurses and doctors and people on the front lines not having enough PPE to address this is scary to think that they weren't prepared for this. I think anybody can admit that. I'll admit it too. But was the shortage of PPE and delay in getting it for this situation, or lack of preparedness, which was a failure on the healthcare system part, was it worth millions of Americans losing their livelihoods and being uprooted completely from everything they knew only a few months ago? Was it worth it? Was it worth it to get all those people out of work, all those businesses closed, just to bail out a healthcare system that clearly has been failing us for a long, long time? Was it worth it? And one more thing, and two more things actually. One kind of thing I wrote down that shows that how I felt at the beginning of this to how I feel now that we know a lot more information. And I wrote down a few phrases that highlights it, and pretty briefly, which was, I agreed with the idea of staying home until the hospitals were able to prepare for the surge in patients, until the opposite happened, where we were seeing hospitals way under capacity and still haven't reached the level that we thought they would be. I agreed with telling people not to wear a mask to prevent supply shortages until guidelines came out about how to make your own mask from materials in your home. I agreed with praising healthcare workers on the front lines during a surge in patients, until they flooded the internet with dance videos on TikTok in hospitals rubbing it in our face that they were not busy and we were all meant to sacrifice our livelihoods for something that isn't happening that we were assured would happen. So those are kind of a brief thing of where I was to where I am now. I could probably think of 10 more statements like that, but that's, I think, the best way to say it. And finally, I just want to conclude here by saying I don't think any less of you, or more of you really, for choosing to wear a mask and covering in public or not. I believe it is illegal. If it is illegal to be naked in public, then you should not be allowed to be told what you can and cannot wear, period. And that's a great point. I know it sounds like, okay, naked in public, this. No, but it's the point. Point is, if there's a law that says you cannot do X, then you can't tell me that I can't do whatever outside of X is, right? So maybe there will be laws that will change the whole mask wearing, face covering thing in the future. One more thing I want to touch on is businesses, how they are, some of them are forcing masks on their customers in order to be allowed in. Some aren't, some are recommending it. But here's the thing, even though I don't prefer to wear a mask in public, if a business said, or business owner, if I walked into their store and they said, we are requiring customers to wear a mask, if you're not going to wear a mask, please leave the premises, we are going to refuse business to you, I would leave. I really would. I wouldn't throw a big hissy fit. I wouldn't try to sue them or anything, because that's their right as a business owner, is to refuse service to people if they feel that it's in their best interest of their business. I might question if I go back there again, but then I'll go to a place that doesn't require a mask or isn't forcing it on their employees, and now we have ways to get essentials without even having to go into a store anymore. I think of Target, who has drive up service, basically, where they pick out your stuff in the store, you drive up and you say what parking spot you're in, and they bring it out to you. That would be a way to go around it, right? And they're a competitor that would allow you to do that. Or if the place that requires masks when you walk in, if you can call ahead of time or do something and say, hey, I want this, this, and this, I don't really feel comfortable wearing a mask, could I pick it up at the door, or could you hand it to me so I don't have to walk in, kind of thing. I think there's ways around it without the government being involved, and while still protecting my right and the right of business owners. So I think I'm going to end on that. I've talked for long enough. I got all my points across, and clearly I couldn't type all this in a comment on a comment section, because it would be very long, and you wouldn't be able to hear my tone or kind of my inflection or anything like that. And I know in comment sections it can get pretty messy, so wanted to keep it as clean as possible. And I thank those people for challenging my view and me being allowed to share my view with them, and for keeping it pretty, for the most part, classy and not personal. I mean, calling someone selfish, using cuss words, clearly being in the heat of the moment by or having typos and errors. We can say that's personal or not, but whatever, it's okay. So this will probably be the last time I talk about masks on my channel, or the kind of the debate between the two. So I hope you had a great Monday, and I will talk to you very soon.